Hello, everyone. Welcome to this session on economic and social returns to health investments. I'm Sue Capps, your moderator for today. We apologize for being a little late due to some technical difficulties, but I'm excited to have a discussion today with panelists from IDB, the Inter-American Development Bank, as well as the Ministry of Economy, Trade, and Industry of Japan, and from the private sector, Pfizer, GE Healthcare, and UPS. At the bottom, you can see the panelists and you can click on them to see their bios. But to get started, we're first going to talk about a study out of the Victoria University. And I believe Lucas Tramontazzi, you'll be introducing this study to us. We'll take a few minutes to go through the study results and then have a discussion about it. So Lucas.
Thank you, Sue. Clearly, I am not Bruce Rasmussen from Victoria University. Bruce is unable to join us due to some technical issues, but he does wish that he would be able to present these findings to you. I am thrilled on behalf of the U.S. Chamber's Global Initiative on Health and the Economy to be able to share the results of Bruce and his team's study on the rates of return on health investment, which estimates the economic and social returns that countries can realize through investments in prevention and treatment of chronic illness. COVID-19 has highlighted the complex interdependencies between health and the economy and the impact that this relationship has on society. We are clearly seeing that those living with NCD-related comorbidities such as diabetes, cardiovascular disease, and respiratory disease are susceptible to the most serious consequences of COVID-19. The pandemic has also exposed the limitations of healthcare systems to respond to these threats while also treating ongoing chronic illness. For the global working age population, NCDs represent 70% of the disease burden. The University of Victoria study demonstrates that there's a powerful economic argument for investing in non-communicable disease prevention and treatment that enables people to work more productively, to increase social and economic inclusion, and to improve the health resilience of the global population in anticipation of future pandemics. This study builds upon the University of Victoria's previous research that estimates the loss in GDP arising from the adverse effect on workforce productivity of NCDs. The University of Victoria sees that the combination of an aging workforce, high and increasing prevalence of NCDs with age, and an increase in NCD risk factors results in heavy costs for governments, individuals, business, and global economies. The study addresses the question many government finance officials ask: what do we get from our health spend? Our hope is that these findings will help build the business case for why health should be viewed as an investment in economic and social development, as opposed to just a cost center whose budgets must be trimmed. University of Victoria examined the treatment of 3 NCD categories: diabetes, CVDs, cardiovascular disease, and mental health, and build a cost-benefit framework to estimate the social benefits of improved health outcomes across 27 countries. They started by leveraging the WHO's One Health tool to calculate various intervention costs per disease and then estimate reductions in mortality and illness as a result of these interventions. They then built an economic model to calculate the benefit of productivity gains arising from increased worker attendance and performance over a lifetime. They then calculated the social benefits of the value of an additional life saved based on the intrinsic value of simply being alive and healthy. They found that on average, countries may realize a return of $20 for every dollar invested in cardiovascular disease and diabetes interventions. Likewise, countries may realize a $22 return for every dollar invested in anxiety disorders and depression interventions. These high benefit cost ratios arising from the enhanced productivity of those being treated demonstrate the value of investing in the treatment programs for these diseases among the working age population. The returns are particularly high among developing countries, emphasizing the importance of addressing NCDs in these countries. This study suggests that beyond the human rights arguments in favor of spending money on health, there are very sound economic reasons for doing so. Such investment, which will lead to higher overall economic growth and social development. I hope that this study will alert government leaders, policymakers, and communities to the benefits that will flow from addressing this silent pandemic. Thank you, Sue. Back over to you.
Thank you, Lucas. So now we want to open it up to a bit of a discussion about these study results. Marcelo, in your experiences in Latin America and Caribbean through IDB, what do you think about these study results? Marcelo, I believe we cannot hear you. Are you on mute?
I was on mute. After 6 months of working through this process, I still cannot unmute myself, but I'm sorry for that. Thank you, Sue. Thank you for the invitation. I think that the report is very timely and needed. If we look at Latin America and the Caribbean today from the perspective of both NCDs and what's happening with COVID, we need to start reflecting on several topics. The first one is that the main problem that we have in terms of death in Latin America, still the main cause, are NCDs, are 90%. If you take Haiti and Guatemala out of the equation, 90% of the deaths are related to NCDs. So you can see how important is that for the region. I think that we also celebrate what the report brings in terms of comorbidities and COVID. We are seeing that in Latin America and the Caribbean. We see increased likelihood of death related to the COVID-19 and NCDs. We're working through that process, and we're trying to see how we can work on that. The other thing that the report brings to the conversation, which is important, is the issue of postponement of care. What we have, it's in Latin America, practically a stop in many of the critical care issues that we have. And that's going to be something that in the next 6 months we're going to be coping with. I want to highlight also something that the report brings, which is the postponement not only of care but of the strategies that we're working in Latin America and the Caribbean vis-a-vis NCDs. And the first one that it's suffering right away is cost-effective approaches that were outside of the health system that we're working. And let's take, for example, the issue of smoking. Smoking accounts for 11% of the death in Latin America and the Caribbean. All the campaigns and all the efforts, regulatory efforts around the issue of stopping smoking, especially for young population, are being basically freeze now. They're freeze, and that's a problem. And two more things that I want to say. The second big issue that we're coping with is health expenditure in the context of COVID, and that's important. The treatment of NCDs is an expensive proposition. We will have a 9% decrease in GDP in Latin America and the Caribbean, and that's going to have a direct impact on health resources. I like what Lucas said about the conversation with finance ministers and how to work on the issue of convincing them that this is an expenditure that they have to make and that it's critical. And the last thing that I want to say is that in the context of NCDs, we need to remember, especially in Latin America and the Caribbean, is that primary health care, it's at the basis of what we do in terms of combating NCDs, the NCDs problem. And we are looking already also as something that is the postponement of expenditures on basic health care that might have a long-term effect. So that's basically my long answer to your question. I like the report. I think that it's important, and we want to be talking about that quite a bit, I think. Thank you.
For sure. And I think, for those considerations that you brought up and those concerns, I guess I would like to ask Inamura-san, what are you seeing in Japan, a larger market compared to Latin America and Caribbean? Are you seeing some of the same things or different?
Thank you for the invitation to the conference. And I think this report is very interesting for me and for us. I mean, in Japan, that as you know, Japan is the fastest aging society in the world, and now over 28% is the population is elderly, over 65 years old, and the number is growing, and we estimate at 2050 the share of elderly exceed 40%. So you can easily imagine that the healthcare cost is imminent issue for Japan, and tackling an NCD is one of the priority for us, not only for government but also for the company. So in this view, I understand that the growing number of company is understanding the importance of taking preventive measure against NCDs, and so the 10 years ago, there are only few pioneering company which take very active measures against preventive measure for NCD, and but now we have the government have started several policy measures to ask the corporate leaders to take that measures, and my Ministry of Economy, Trade and Industry started what we call Health and Productivity Management Certification in 2014. And it started with less than 30 companies, in best company in each industrial sector. And the number has grown each year. And now for the latest certification of last year, the participating companies exceeded 6,000. And for the largest company listed in Tokyo Stock Exchange, more than 25% has participated in this program. So we think the growing number of corporate leaders understand the importance of taking the measures. And they clearly understand the correlation between the health and productivity. And let me talk about different aspect and features on the national healthcare cost. And we think the preventive measures to NCD is quite important for the national budget, and because the healthcare cost for elderly is quite higher than younger people, and the baby boomers in Japan is approaching their elderly, and the cost is expanding very fast. So and then it's too late to wait until they retires. So it's quite important to ask the company to start preventive measures, taking preventive measures while the worker is still young. So I think the government is keeping a good relation with industries to take measure against NCD, and I appreciate the international comparison of this kind of analysis. Thank you.
Great, thank you. And so, to this point about getting the private sector involved, I'd be interested in Angela and Chris, your experiences. What are you seeing from the private sector in terms of some of the issues and what the study results show? Angela, do you want to start?
Sure. And thank you, Sue. Thank you for the invitation to this important discussion. I think from a Pfizer perspective, this study affirms what we already believe, right? That health is wealth. And that non-communicable diseases don't just affect health, they're major drivers of poverty and inequality worldwide. So let me just make a few observations from the study. I cover policy in emerging markets, and I think the study is really important in these regions where the current focus is on COVID-19, and that's rightly so. But I think as we grapple with this pandemic, we can't ignore the impact that NCDs are also having at the same time. So I think what the study does is powerfully demonstrate the impact of the pandemic on NCDs. You can't address one in isolation of the other. So during the COVID-19 pandemic, I think we can all see that health inequities are not only growing with respect to infectious disease, but those living with NCDs are or could be at greater risk. I think what the study also does really well is underscore the need for multisectoral partnerships, right, to address the global NCD burden. One industry can't do it alone. And so the study clearly makes it clear that we need to bring a range of stakeholders to tackle this issue in a holistic way. So coordination and building the respective strengths of partners is key. But my takeaway from that portion is that leadership of governments is key. All partners need to fit within a government's own strategic plan. Now, let me just say that in the study, I was a little bit surprised to see that by far the highest economic and social benefit ratios for investing in cardiovascular disease, diabetes, and mental health across the 27 countries studied are in my own home country, Kenya. And I think this will resonate with you, Chris. This statistic for me amplifies the importance of the work that companies like those represented on this panel and Pfizer do. So the Pfizer Foundation, for example, supports small, smart investments around infrastructure development. We need to make concerted efforts to reach that last mile in developing countries, to support the training of community-based healthcare workers, and in general, promote access to quality healthcare across the 27 countries studied. I'll say that in emerging markets, unlike in Japan, there's one big positive that I think we can all focus on, and that is the young population. So as we consider NCDs, a lot of the educational work can actually be done with the youth in schools, right? So educating about appropriate nutrition, exercise, the importance of preventative health measures, and annual physical exams. There's a really good opportunity, at least in emerging markets, to capture all of this with the younger population. And finally, many of the countries in my region are rolling out universal health care. So really ramping up their national health insurance plans. I think this study gives policymakers the language that they can use with finance ministers, as you mentioned, Marcelo, to be able to make the case for investing in expensive NCD prevention and care. I think the return on investment is compelling, and countries would want to use this data and use, as I said, sort of the language around ROI to make a compelling case to ministers of finance. So I'll stop there and happy to answer questions.
Great, thanks, Angela. Chris, what's been your experience when you think about these study results and the comments made?
Sure, Susan, thank you very much. Good day to everybody. I'll pick off from kind of where Angela left off. Because I think my focus with GE Healthcare is on emerging markets. And effectively there we have the triple burden of disease. You have obviously the communicable disease, which we're all still battling with horribly. You have pandemic, which is, so obviously clear to us now with COVID-19. We had Ebola last year in some parts of our region. And now you have, the ever popular growth of NCDs. And unfortunately, if you look at the World Bank, 40 of the world's poorest countries are in Africa, and there's only 54 countries. And so the impact of these things is enormous. The report highlights some examples where this productivity can be measured, should be measured, and could be used in the future. And I think that's part of our responsibility, to answer your question, as the private sector, is to use that with the relative ministries of finance and health to show them that there is an absolute requirement for prevention, preventative medicine, and even preventative imaging. So my colleague mentioned around, primary care. Primary care is the beginning of everything. There is very little screening in most of our emerging markets. Then you couple that up to the various stages of cardiovascular disease and the dreaded cancer and oncology. You see that most people are spending huge amounts of money, where they have money, on travel, because the ability to fix your loved one in Africa is actually quite low. And so 70% of health spend actually goes on travel rather than health. And so I think that preventing these kind of diseases, or imaging early, or preventative health in primary care, is absolutely critical to ensuring that a population can become healthier and hopefully a little bit wealthier. At GE Healthcare, we build projects and programs with major worldwide funds and other companies. This is to Angela's point. Private companies like GE Healthcare and Pfizer, etc., have a responsibility to work in private-public partnership with governments to really help them look at the challenge, because no company, no government can fix it on their own, and work on key parts of the health infrastructure that can be modernized, can be improved, and can take benefit from some of the elements in this report.
Great, thanks, Chris. So This leads me into an important topic you all have raised about prevention, a younger population, getting involved, with the workforce, the role of the private sector, as well as with the government sector. Some of the solutions here, you've all been part of this. What do you recommend in terms of some of the solutions here around prevention and helping people who are younger, stay healthier? Because as you said, Inamura-san, you don't want to wait until people retire to think about health.
I can take the first part of that if you like, Susan. Cool. At GE Healthcare, we are really, really keen on sustainable health. It's got to be appropriate for the country. So we're a healthcare technology company. We have a range of products that are suitable for the market in which they are intended. So we have, low voltage systems. We have easy to train, easy to use ultrasound for rural midwifery, right the way through to appropriate cardiovascular technology. I think as private companies, we have got to be sustainable in all we do. And that means that if we place equipment, solutions, drugs within a country, we need to be there or have a response for the future. Healthcare is not about today and tomorrow and what happens in the next 3 months. It's a long journey. So we, as GE Healthcare, we put our solutions first. We put people on the ground. We put service and maintenance engineers. We put clinical engineers. We put clinical education and training at the forefront of most of what we do. Putting a piece of equipment into a country is not a solution. Putting a piece of equipment with training, education, support, partnership, service, maintenance on the long term is absolutely essential. And that's what GE is trying to do in emerging markets today.
Angela, can I add something here? First of all, I want to two reactions. When we talk about emerging markets, I think that is super important, especially when we talk about Latin America and the Caribbean, to differentiate a little bit. We're going to be, by 2085, the oldest region in the world. We're going to go very quickly from being the youngest to being the oldest. So for those that are thinking about government and private expenditure and investment in healthcare in Latin America and the Caribbean, we need to differentiate. And we need to differentiate, and we need to find different models for different countries. Uruguay is not the same as Haiti in terms of the population distribution and how we can access that kind of market. So that's an important thing. And I think that the other thing for private sector companies entering into the conversation is something that if we talk about the need for more equitable health solutions, is to not to be able not to contribute to the big fragmentation that we have of healthcare system in Latin America and the Caribbean. So I like what Chris is saying, actually, and that responsibility is, of course, a joint responsibility of governments and private sector. And last but not least, I want to say something about the COVID. The issue with the COVID here in Latin America and the Caribbean at this point is that if anything that we learned during these 6 to 8 months that we already have of pandemic will actually will help us to navigate what's coming up next. So for private companies also, a conversation that governments wants to have is how to capture what we learn collectively in order to apply to investment going forward in the sector. So that's the other joint responsibility that we have. Thank you.
So
yes,
go ahead, Angela.
With my fellow panelists, I think I should reiterate that we believe that governments need to own that healthcare governance framework and policy direction for their country's own unique path, right, to address NCDs, and then to engage with partners to ensure that they're all working in support of that framework. And so, I don't see the private sector as simply implementers. I think we can be very helpful even in shaping those policies with government as they develop their objectives and goals in this space. I mean, if tackling the burden of NCDs requires, strong health systems and collaboration across the entire health continuum, I think companies like GE and Pfizer have the benefit of global experience as well. So we can share best practices and lead by example, not just as service providers or providers of products, but quite frankly, as employers and as members of those communities in which we work, right? And so we can partner with government and other product and service providers to share practices around wellness programs, which you don't necessarily see a lot of in many of the emerging markets. I think that's one area where there's a lot of room for it to take root. And so as a company, we also, as Pfizer, we also dedicate significant resources to primary health, disease awareness, prevention campaigns, and continuing education programs. Again, those are things that I think we can share, not just as a company operating in that space, but really, quite frankly, as a member of that community. At the end of the day, we believe that we can't make any progress, right, to fight NCDs without empowering patients, communities, and healthcare professionals to make healthy choices for themselves.
So as we think about that, in terms of that type of education and coming together on this, are there examples of partnerships between the private sector and government that you found that work best? So speaking of sharing best practices.
Let me briefly explain the Japan situation. And I call my colleagues that it is quite important that both government and private sector takes initiatives. And in Japan's case, we have some government regulation which mandates private company to take measures for prevention of NCD of their employee. For example, every companies are required to provide annual health checkup for all the employee for free. So this is a good thing, but I think this kind of government regulation is minimal. So it's also important that the private company can do more. And then there are a lot of pioneering company, and we can help this best to share this best practice among other companies. So I think it's quite helpful that your report, the report you showed us, is for nudging or pushing these companies to recognize the importance of investing in employees' health, and the fact the return is quite high is very attractive, I think. So we can the government can push the private sector to copy this kind of best practice around the world.
Yeah, no, that's great. And other examples anybody has seen? I mean, that's a great point that you make about the government pushing on that.
Yeah, I mean, I think it's really important not just to see companies as partnering with government, but also companies partnering with each other and then approaching government. So Pfizer is proud to be a member of Access Accelerated, which is a global partnership working towards the UN Sustainable Development Goal target to reduce premature deaths from NCDs by 2030. And this initiative includes 22 biopharma companies and partners. And it also partners with other institutions like the World Bank, the Union of International Cancer Control. So again, demonstrating that really we can collectively offer a holistic solution to government. And this partnership really is going to help address a full spectrum of access barriers to NCDs in medicines in low income and lower middle income countries. And the focus there is on, as I said, NCDs, mostly oncology. Also, through the Pfizer Foundation, we're advancing cancer care for women in low and middle income countries where breast and cervical cancers are among the most leading causes of morbidity and mortality. And so we support projects, for example, in Peru, in Brazil, in Rwanda, and in Kenya. And I think what's important here is we really try to integrate breast cancer outreach and early screening and diagnosis into existing primary care systems. So we're not creating an additional parallel system to what the government is trying to do. And through these programs, we've actually connected thousands of women to oncology services. Again, small, smart investment that has a big impact.
Susan, let me go back for a second to the issue of efficiency and the need for efficiency, especially after the COVID and the crisis, the economic crisis that we will have. And when we look at the landscape in Latin America and the Caribbean, and we talk to those that are making the decisions, we are investing nowadays $1 billion a year in this portfolio. 60% goes to basically NCDs in Latin America and the Caribbean. And what the Minister for Finance are asking us is for more efficiency and for results. And so there's several issues, several examples of how the private sector, sorry, can actually work around these topics. Our countries are asking for example, for health from the private sector investment on the issue of logistics to actually move better and more efficiently or just in time drugs and supplies. Those are scarce, they are valuable, and they need to be moved better. So that's the first topic, big topic for private companies to work with governments immediately, the issue of logistics. The second one is, of course, public-private partnerships. And there is, they need to work together, the companies of the private sector and with governments, as Angela said. And in Latin America, we are seeing now, and I have my notes here, 40 new private-public partnerships under consideration and 18 being developed. These are too little public-private partnerships, and we need to increase them. Nowadays, Peru, Colombia, Trinidad and Tobago are at the forefront of this, but issues of procurement and regulatory issues needs to be dealt with in order to advance those topics. I have two more topics, telemedicine and computer-assisted diagnosis and protocol guides. And for telemedicine, I just want to say that it's not fashionable, it's needed. And the need to have a strong system to do it underscores the solutions that we might have. For example, in Colombia, we went from 300,000 consultations to 4 million consultations a month. Okay, that's a huge market and needs to be diversified. And last but not least, the use of technology needs to come with training for the personnel. So for the private sector, especially working through procurement issues and through the supply of equipment, they need to take into consideration, especially the issue of training the personnel. We are still not dealing with with technology natives. We're still dealing mostly with people that are not familiar with technology, and that I think we need to work through those topics as well. I stop there.
But you bring up a really good point, and I would like to talk about this in terms of technology, digital, telemedicine. How is this going to help us, and how can we partner together between the different groups in order to help people with NCDs and really hit those sustainable development? What are your thoughts around this, around technology and digital health?
Maybe I can pick that one up, Susan. Look, technology for technology's sake doesn't work. To Marcello's point, it isn't fashionable. I'll give you a real life example in my home country. So the burden of disease and oncology in Kenya is significant. People are coming in with stage 4 cancer. There's no screening. So there are a bunch of governmental goals set by His Excellency to really support the oncology program. But where do you start? So we partnered with a group of institutions, some British ones, to be honest, and we created an oncology program in partnership with the Kenyan Ministry of Health. That's going to result in the building and development of an oncology center, specifically at the Kenyatta Teaching Hospital. This was publicly announced a couple of weeks ago. But that comes with it, with not just the technology, but with 3 years training, 3 years education, a full program of telemedicine to support. GE can't provide all of those things. We provide all of those things with partners, because a working oncology center or a working cardiology center is not just an equipment solution or a teleradiology solution alone. It is a combination of partnerships. And I think we've got to be getting better at partnerships as private companies. We can't solve these issues on our own. But in turn, I think some of the governments, and this is where reports like this help, need to look at things from a different perspective and need to look at the cost and price and tenders with different eyes. Because a long-term 3 to 5 year solution that really benefits the people of Kenya is something that's extremely hard to tender. And so the role of technology is a much longer term view rather than today's view of procurement. I hope that helps.
Can I just put a positive spin on what you said, Chris? Because I see the pandemic as having accelerated the uptake of technology significantly. I think emerging markets are very good at leapfrogging technology. And you mentioned Kenya. Everybody now, can get on their phone and conduct a number of services on the phone. And so I think with the pandemic and the platforms that it has created, there's room for us to leverage all of that in terms of using diagnostic tools, in terms of monitoring, in terms of providing routine care, using those platforms to perform healthcare services that normally would be in a clinic or hospital, right? And so I do think that if we as a private sector, we can tap into the local talent as well. I mean, I think I get your point that it's very difficult for a GE to come in and do all the training, but there are a lot of really smart local technology entrepreneurs in emerging markets. And I think this digital health area is ripe for innovation, local innovation in this space. And so as a private sector company, I mean, I would want to partner with the most promising of those technopreneurs, as we call them, and see what we can come up in terms of sustainability platforms. So I actually see it as a very promising in the short term and in the long term area for development.
I love the technopreneur name. I'm going to use it quite a bit, Angela, from now on. And by the way, the most important provider one of the most important providers of telemedicine in Brazil is a technopreneur. So you can see, and that allows essentially for people in the Amazonas to be connected with Sao Paulo in certain conversations. I want to add something. When we talk about technology, we cannot forget, to your question, Sue, about what do we do to make this more equitable. We cannot forget the issue of data availability, and that seems to be an arcane and lateral conversation, but it's the most important one from our perspective. The lack of health records on digital platforms that allow us to actually look for opportunities to use technology and also to create accountability around the use of technology is perhaps one of the most important challenges that we have. So for the private sector working with governments, we need to work on the issue of electronic health records and how to improve the information that we have. Otherwise, we know what's going on. Those that have connectivity have access to better quality services using technology versus those that do not have connectivity, do not have that kind of situation. Sorry.
No, thank you for that. And so some of the experiences that you all have had around, this is a good point, around data. Is there some things that we can be doing to help improve how we can get electronic health records or data involved? I know you all may not be technical experts, but anything that you've seen around that in terms of data?
I think it's fair to say it's a minefield.
It's a minefield.
I think it's a minefield. I think, yes, there are many companies out there. G is one of them. We have full command center solutions, but I think that's maybe a subject for a different call. It's a huge topic on its own right. But yeah, I mean, data is important. I think what the report shows us is that data is available now. We don't need to look to more data immediately. There's data available now that shows that we can quantify the benefit or disadvantage of not moving ahead in certain areas, and the report helps us to do that. And I think we need to use things like this more with the governments.
And that's a great point that you're making, Chris. That we have a lot of information now, and let's not wait to start using it. So that's a really great point. Let me ask you a little bit. You all have talked about this in terms of, working locally and trying to, do training and education, but just in general around public-private partnerships, what kinds of things do we need to be doing to build that capacity? How can private get better? How can some of the other partners and how can government get better at doing more partnerships?
Yeah, I'm glad you asked that question too. I mean, I think it's sort of the elephant in the room when it comes to the private sector. There's like a healthy skepticism of our participation in what governments perceive to be their role, right? And so I think to make partnerships successful, there should be trust, and that's something that's built. I think trust is critical to the success of public-private partnerships, and that's reinforced by acting in good faith, not always in your sort of interest. I think transparency among partners and open communication is clearly important. I think there should be clarity of purpose, and I mentioned that earlier with this sort of umbrella strategic plan that we're all working towards. But even within that, when you're having multiple partners in these partnerships, I think there should be clarity of roles, like what value is each partner bringing? So we're not duplicating roles, we're not competing with each other, we're really trying to add our own unique value. I think one area that we don't always do really well in these PPPs is coming up with metrics, right? I mean, I think accountability mechanisms, they need to be built into each process. And so it's important also then to have a clear baseline from which we are building. And then, finally, I'd be remiss to say when it comes to PPPs, especially in the space of non-communicable diseases, I think partnerships need to take into account the unique role that women play in the healthcare system. So hear me out. Women are in many of our emerging markets the chief medical officers in their families, right? They make significant medical decisions, health decisions, spending decisions for their families. And so I think these PPPs need to have or adopt a gender lens to be able to be effective. And they need to recognize the unique role that women play in the healthcare space for themselves and their families, and then figure out a way to harness that power effectively.
Yeah, great point. But and some of the things that you just talked about, Angela, in terms of, the trust, the clarity of the roles and the metrics and the accountability. Any other experiences that you all have had, in your various organizations about what works around that?
I agree with Angela. It's quite important to have solid trust between government and private sector. And for that, I think it's quite important to build a good evidence between the health investment and the returns on the productivity for companies. And it's quite difficult because the real effect of the health investment while people are working age that really comes up later in their lifetime. So it's quite difficult to prove the perfect correlation between the health investment and the return, especially for the non-community NCDs. So in our program of health and productivity management certification, we're collecting data from companies, and we provide this kind of data to researchers to make a solid analysis on this relationship between the health investment and the effect of these kind of preventive measures. So, and not only inside the Japanese government, but we also can expand this kind of collaboration among the government and private sector with other countries. So we are still trying to improve these kind of analysis, and so a collaboration among other countries are very helpful to make a good case for this kind of analysis.
Any other thoughts on that in terms of how we can build upon and improve upon our partnerships so we can do more of them?
Yeah, I think maybe just to add, I think many governments are exhausted with sort of pilot models. Companies come in and they want to set up a pilot, great idea. I think partnerships need to be scalable with the ability to pivot early when the programs are not working, obviously in partnership with government, and then or to exit entirely. I think it's important, yes, to have a pilot to demonstrate that actually you can do this and that you can build on that evidence to make it bigger. But you need to come into the country, and discuss with the government what that scalability looks like. Again, I think that endears trust with the government, and it can also open up potential local partners that you may want to work with who would sustain the project far after you've exited.
That's a great point, instead of just talking about pilots. Okay.
But perhaps to add to what Angela said, one of the things that I think that are important is to evaluate and learn from what we have experienced with COVID. In part, the scalability and the going from pilots to scale up experiences are related to what we have done during these 6 months. What these 6 months have proven is that in certain areas, if you're strategic, you can move from small experiences to big experiences very quickly. And I think that we need to learn more about that, and governments should work with private sector to integrate those lessons into what's coming up after the COVID.
And Marcelo, your thoughts on then how to go about doing that? To have a conversation with government, to try and take that lesson and apply it into a real world situation. Any thoughts about how to implement that?
I think that the studies such as the one that we're discussing, it's one of the concrete actions that we need to take. We need to look at that. We are creating here at the IDB now around 10 studies, evaluations actually of programs that were rolled out during the COVID in order to see what kind of practice and experiences we have. I talk about logistics, for example. A lot of the logistics to distribute emergency equipment and other equipment, it's of interest to us. So that's the first one. The first one important thing to do: study and evaluate. The second one is to have more involved conversations about how to do things differently after the COVID. I'm afraid. I mean, I'm sometimes optimistic, but many times also pessimistic about what's going to happen after the COVID, after the vaccine it's here. And if everything is going to go back to normal, that is to say, to what we had before in January, it's a real concern to us. So that's I think another area that we need to work on, the conversation about how it's going to be different. Sometimes imagining, it's a little bit of a utopia, it's utopic, but I think that we need to be utopic in to really improve what we're doing in healthcare in Latin America and the Caribbean.
Is there something, speaking of, what it's going to look like after COVID and there's a vaccine, so specifically some things that we should learn from this that we should do differently? You all mentioned telemedicine earlier about it being necessary, not nice to have. Other things that you think that we should, take advantage of and never go back to and do things differently?
Yeah, I mean, I think one thing is we've all realized that we belong to a larger organization, as it were. You can't just sort of make plans for your country, but in infectious disease in particular, you see the effects of what happens in one country in another. I think what we should try and strive more for is coming up with these strong regional plans as well. So I think having national strategies are important, but I think in terms of efficiency, in terms of procurement, as I think Marcelo mentioned, procuring efficiently, I think these regional groupings make a lot of sense. In terms of disease control, the policy making. I mean, so I think, again, this is an area that's ripe for upscaling, whereas I think the tendency has generally been to sort of go back to our own sort of national strategies and tendencies. So I'd like to see more regional integration.
Okay. Chris, did you have a comment?
Yeah, I do. I think, we're learning how to make change quickly. That's something that we've had to do as a company, and our customers have had to do as well. Can you imagine a year ago telling a customer, I'm not going to turn up to train you how to use your ultrasound machine? We would have been laughed off the face of the earth as an inefficient company. We've had to change the way we operate massively. We're physically not allowed to go into hospitals. You physically cannot cross the border between 5-6 different African countries to go and train somebody. So we've had to become agile. We've had to embrace new ways of doing things, and we cannot go backwards after this. I think we all become a bit more efficient, and that includes our customers. We've been able to train probably 3 times the amount of people remotely than we could do physically. And so, that means we don't jump on a plane and go to a country and train somebody. It means we've got to be better, more efficient, develop new tools, and find a better way of doing it. And those better ways have to stick for the future. So that's a responsibility we have, again, as private companies. But I think, again, studies like this and more studies to help and to find partnership will help us all, including the governments. And the governments are swamped, by the way. Yeah. Can you imagine being the Minister of Health in a country coming out of Ebola, coming into your day job, and then COVID hit. I mean, this is just a nightmare for all of our governments. And the fact that they're even barely coping with it is a miracle as far as I'm concerned.
Yeah, I mean, that point is super important. You have an overwhelming situation for health ministers in Latin America and the Caribbean. At least they are changing quite rapidly. The turnover, it's just incredible sometimes, and it's not good. It's bad, actually. But I want to add to the issue that Chris raises, which is the issue of training personnel. You talk about telemedicine, we are talking about telediagnostic, but I think that the issue of training and what private companies have learned during the COVID in terms of training, like in the case of Chris, I think that it needs to permeate in what governments are doing. I think that it can be done in a trickle-down effect, and it can be very efficient. And training means not only providing the training, but the curation of content, which it hasn't been done for the health sector as it should be. There's a lot of content out there; it has not been curated. And the other issue is quality control of that training, because while I trust Chris, of course, that the quality of training provided by his company is good. Once you go into massive kind of training using the digital media, you might lose quality, and you don't want to lose quality in this kind of health situations.
No, for sure. I appreciate that, Marcelo. So we are coming up on time. We only have a few minutes left, and so I want to make sure that I give all of you a chance. Is there anything that we didn't talk about that you wanted to make sure that we brought up to the audience today?
Maybe we did bring it up, but I just want to underscore, I think, the importance of having these conversations between ministers of health and ministers of finance. And I think a study like this really helps to reinforce the connection. And so I guess my call would be for the countries that have been studied, and even those that are not included in the report, I mean, to use this as a really powerful tool to make the case for increased investments in healthcare.
Yeah, from my perspective, Susan, I think I'm going to go back to what Lucas said right in the beginning, which is around health not just being seen as a cost center. I honestly think that's a dream that we need to get to, and reports like this will help us do that, because today health is a cost center.
Okay. And then I want to say, Inamura-san, to the comments that were just made, are you seeing that, in Japan, because your participation today, that connection between economy and health, is your government making that connection, and you're having more conversation around health as an investment?
Yes, for the I think we started our effort of health and productivity management certification in last 6 years, and still it's in infant stage, and so we have many things to improve. One example, under the influence of COVID-19, and we have to update the way how the companies take care of their employees' health. One example is that, as you imagine, that in the workers around Tokyo mainly use public transportation every day, and then on average the workers walk 8,000 steps per day usually. But since the many workers shifted to telework, they reduced their walk. To less than half, and that makes a different problem. So lack of exercise, and then we see many cases where the worker report that they due to the lack of exercise, many of them increase their weight. So this is another aspect of the influence of COVID-19. So I think there's no a clear goal of their effort for improving their employees' health. So we have to and enhance their collaboration with the private sector. So we'd like to keep learning from other countries' experience, and we'd like to share what we have learned so far. So this conference is very helpful for us. Thank you.
Susan,
Great.
so
Yes.
at the risk of being voluntaristic here, I think that I need to leave the conversation at least with a positive statement.
Yeah.
What COVID showed in Latin America and the Caribbean is that for those that we complain for years about the slow pace of change, it's not a question only of capacity, but it's a question of determination. I think that determination has brought COVID has brought determination into the system. And I give you two examples. ICU units in Latin America have increased by 6 times in 6 months. We've been pushing for that for years, and in 6 months, we have 6 times the capacity that we had before. Or, for example, since we're talking about telemedicine quite a bit, the legislation around telemedicine didn't exist before. Now, in 9 countries in Latin America and Caribbean, suddenly we have legislation that would actually help us to use telemedicine in an effective way. So it can be done, I think, and we need to learn from COVID moving forward.
No, great. And thank you all for this conversation that we had today. I couldn't agree more. Let's learn from this. Let's take advantage of some of the positive things that have come out of this. This study is talking about how we can all improve health, and as we talked about even in Japan with worker productivity. So let's continue to have these kinds of conversations so that we can fully move forward into good public-private partnerships, move health from a cost center to an investment, and start to really realize these benefits so that we can affect the sustainable development goals that we have around NCDs. So thank you all so much for your participation and discussion here. And I do want to say sorry that just so everybody knows, unfortunately, we had some technical issues, and Dan from UPS could not join us. So, but thank you all for your discussion. We appreciate it.